I'm Dr. Balaji Jaganmohan. I'm a practicing diabetologist at the Apollo Sugar Clinics at Padmanabha Nagar and JP Nagar in Bangalore. Today, I want to talk about heart disease in diabetic individuals, particularly type 2 diabetics. Now, when we talk about heart disease, there are two main conditions that a diabetic has to be watchful about. The first is what we call coronary artery disease, where there are certain blockages that develop in the arteries of the heart, what we call coronary arteries. And if certain risk factors are uncontrolled, then these blockages can further aggravate, and that person can develop something called a myocardial infarction or a heart attack. The second condition that is important for heart disease is basically heart failure. And this heart failure, more often than not, is because of a heart attack that the patient has had previously, or if there are other risk factors that are uncontrolled and the patient can develop heart failure. Now, what is heart failure? Basically, the heart muscle becomes weak and it is not able to pump enough blood to meet the oxygen demand of the peripheral tissues. Now, talking about heart disease, the most common cause of death in a type 2 diabetic individual is heart disease. It can be heart failure or it can be coronary artery disease leading to a myocardial infarction known as heart attack. Now, remember, almost 90% of diabetics will not have the classical symptoms of heart disease, which means they will not have any chest pain. They might have an occasional breathlessness when they're climbing stairs. Some of them might not even have those symptoms. So it is very, very important to screen for heart disease right at the time of getting diagnosed with type 2 diabetes, and then every year at least once. So how do you screen for heart disease? You need to get an ECG done, resting ECG. If there are changes or if the physician feels that you need higher tests, then you can also get a treadmill test done. In some instances, you might have to get an echocardiography done. If there are major changes in these tests, then you might have to get a CT coronary angiogram or even a coronary angiography done so that we can pick up the blockages in the heart to pick up this coronary artery disease. Similarly, an echocardiography, which is done annually, is very important to pick up the ejection fraction or the pumping of the heart. Most diabetics have a condition called heart failure with preserved ejection fraction, which means that the ejection fraction will be above 45% and they might not have any symptoms, but it will be picked up in an echo that they have preserved ejection fraction heart failure. If the risk factors are uncontrolled, they can even progress to something called heart failure with reduced ejection fraction, where the EF is less than 45%. So screen yourself for heart disease at every visit, every year at least once, and if possible, the physician should refer you to a cardiologist if there is any intervention that is required, especially a coronary angiography. Other thing that most diabetics have to be watchful about is to try and prevent a hypoglycemia, because a hypoglycemia can also trigger an arrhythmia, or it can worsen heart failure, it can lead to hospitalization, or it can even lead to a heart attack. So screen yourself. You might have to take certain medications that lower the lipid levels, that will try to prevent the blockages in the heart, what we call antiplatelet drugs. But most important is ABC, that is keeping the HbA1c under good control, keeping the blood pressure under good control, and keeping the blood cholesterol under good control, and trying to avoid smoking in order to prevent heart disease. Thank you.